Anorectal malformation or imperforate anus is a congenital anomaly of anorectal canal. The incidence is 1 in 4,000 live birth, and comparing to female ratio, males have more predominance to ARM. It is associated with water or Vactral syndrome. Pathophysiology of ARM. Usually, genital tract originate from the embryonic structure called cloaca. By the 7th week of gestation, membrane separates the rectum from anus. If the membrane that separates anus and rectum is not absorbed, union of anus and rectum does not occur, resulting in anorectal anomaly. Usually by 8th week of gestation, the membrane will be absorbed and union of anus and rectum takes place. But it is not happen in anorectal anomaly. This is the normal anatomy of anorectal canal. So rectum continues as a anus, anal canal. So here there is abnormality or fistula development or agenesis or atresia formation in this area. That's why it is known as anorectal canal. Anorectal malformation. Now we can see which all are the common types of anorectal malformation. So the first one, stenosis of anus. So in stenosis means narrowing or stricture. So here there will be narrowing of anus at level 1 to 4 centimeter above the anus. So in this picture you can see the anal opening that is 4 centimeter above the usual anal opening. So that is the stenosis of the anus. Here there will be a stricture or narrowing 4 centimeter, 1 to 4 centimeter above the anus. And this occurs only 10% in anorectal malformation. Next one, rectal atresia. A normal anus is present, but a rectum ends as a blind pouch in the hollow of the sacrum. In this picture, you can see that rectum is blindly ends. It is not connected with the anal canal. There is an anal opening here, but rectum is not connected with anal canal. So that is rectal atresia. Rectal pouch is blindly ends. Another one is anal membrane atresia. A persistent anal membrane produces obstruction behind which meconium can be seen. So in this pathophysiology, we have seen that a membrane is formed in the 7th week of gestation, right? So this membrane acts as an obstruction to the communication between rectum and anus. So this obstruction, when we are removing this obstruction, this anus and rectum will be connected. So in anal membrane atresia, a persistent anal membrane or a persistent anal membrane that produce obstruction. Next one, anal agenesis or imperforate anus. An imperforate anus, possibly seen as a dimple with a rectum ending as a blind pouch some distance above the anus. So here in anal agenesis there will be a dimple. Anus will appear as a dimple. There is no opening, just as a dimple, and rectum ending as a blind pouch. That is known as anal agenesis. And 80% of anorectal malformation is anal agenesis or imperforate anus. So what will be the classification, what will be the clinical features? So here usually the meconium will be passed within 24 to 48 hours. It will not be takes place in anorectal malformation. Then when we are examining the child, there will not be any anal opening. Stool may be passed out either through vagina, base of penis, or scrotum or urethra. That means there may be presence of fistula, abnormal connection between the rectum and genitourinary tract. Then abdominal distension and vomiting may be present. Then presence of fistula between rectum and reproductive organ and urethra may be observed. Then presence of meconium in urine due to the fistula. So these all are the features can be seen in anorectal malformation. Diagnosis. How we can identify this condition? The diagnosis mainly by physical examination. There is absent anus, or there will be a dimple, or the presence of fistula. Okay. Then cystoscopy. Then IV pyelogram or voiding cystourethrogram are performed to evaluate associated anomalies involving urinary tract. Other diagnostic examination include pelvic MRI, radiography, ultrasonography, and fluoroscopic examination in order to identify the pelvic anatomic contents and lower spinal anatomy. So main identification or main diagnosis is physical examination. There are different classification for AR that include wing spread classification, Pinnas classification, Crick and Beck classification, and anatomical classification. Here, wing spread classification commonly used. In wing spread classification, again it is divided as high ARM, intermediate ARM, and low ARM. High type of ARM, it includes in boys, it represent as a anorectal agenesis. Girls also anorectal agenesis. It may occur with the retrovesical fistula or without fistula or rectal atresia. In intermediate type of anorectal malformation, in boys, it is associated with rectobulbar urethral fistula, anal agenesis without fistula. In girls, it will be rectovestibular fistula or rectovaginal fistula or anal agenesis without fistula. In low types ARM, in boys, usually the anocutaneous fistula and anal stenosis. In girls, along with the anocutaneous fistula, anal stenosis, there may be chance for anovestibular fistula. So this is the wing spread classification. So based on the position, again it is divided as a high, intermediate, and low. That is the wing spread classification. For management, we are using this wing spread classification. Next one, Crick and Beck classification. Crick and Beck classification, there is two types of classification under that: major clinical group and rare regional variants. You just understand there is major clinical group and rare regional groups or variants. Then in Pinnas classification, there will be non-syndromic ARM and syndromic ARM. That is the classification. Pinnas classification, it includes the non-syndromic ARM and syndromic ARM. That's all. Just understand there is a classification. That name is Pinnas, and non-syndromic ARM and syndromic ARM is there. Okay. Last one is the anatomical classification. Anatomical classification based on the anatomy, location of fistula or location of problem, anorectal malformation. Based on that anatomical classification. So in male, it is perineal fistula, rectourethral fistula, rectovesical fistula, imperforate anus, rectal atresia. In female, perineal fistula, vestibular fistula, then persistent cloaca and imperforate anus without fistula, rectal atresia. Okay, so this is the anatomical classification. Anatomical classification based on the anatomical location of anorectal malformation.